The World Health Organization says the Ebola outbreak in Eastern Democratic Republic of Congo has been circulating for at least 2 months and will likely continue to grow. The outbreak has been linked to more than 130 deaths and at least 600 suspected cases. The UN agency is calling this a public health emergency of international concern, but not a pandemic. Secretary of State Marco Rubio says while the WHO was late in detecting the outbreak, the U.S. is now designating some $14 million in assistance to help set up dozens of clinics and contain the emergency. But he acknowledged the remote location in a war-torn country makes access very difficult. For more, CBS News medical correspondent Dr. Céline Gounder joins us. She's also editor-at-large for public health at KFF Health News. So the State Department announced 50 Ebola response clinics. Will those help?
Well, it depends on what they actually do. So when pressed, the State Department described triage, screening, and isolation, which means identifying who's sick and separating them. That's not treatment. So the only thing that's really going to lower the death rate here is going to be aggressive supportive care, because we don't have specific vaccines or treatment for this kind of Ebola, remember? So it's fluids, could be oral or IV fluids, managing bleeding, supporting people's organs during organ failure. This is really labor-intensive work, and it requires people, it requires supplies, so all of the personal protective equipment, which you go through in reams and reams of, right? And a screening facility without real treatment, it actually becomes a place that's risky for people to be transmitting to one another. And it can also destroy trust because people worry about, therefore, am I actually going to a place that's going to give me any kind of treatment? Am I just going to get sick by going there? In addition, I just saw the Uganda Ministry of Health tweeted that they are not engaged in setting up these treatment centers. They're not even aware of any being set up by the United States there. So there's clearly some discrepancies in what's happening and what's being said is happening.
We also know an American doctor infected with Ebola in eastern Congo has been sent to a hospital in Germany after the White House resisted bringing him home for treatment. The U.S. brought Ebola patients to the U.S. in 2014. Why was he sent to Germany?
Really interesting question. So after 2014, the U.S. actually set up over a dozen different sites across the country, including Bellevue, University of Nebraska Medical Center, Emory, and some others, to deal with exactly this specific situation. And according to the Washington Post, the CDC and other federal officials pushed to bring Dr. Stafford back to one of these facilities in the U.S. They were reportedly overruled. The Washington Post reports that the White House resisted, and there was actually a lot of back and forth over the weekend, causing delays in the doctor's evacuation. And that delay matters because Ebola can go from fever to multi-organ failure in just the course of days. The White House denies this, and they say he was flown to Germany because it was a shorter flight time.
Okay, Dr. Céline Gounder, thank you.